evening, ladies and gentlemen. Excuse me. I'd like to call this regular meeting of the Stoughton Area School District Board of Education to order. Ms. Egan, could you please call the roll?
Yes. Mr. Bouban.
Here.
Mr. Coughlin.
Here.
Mr. Fry.
Here.
Ms. Fitzgibbon. Here. Mr. Jackson.
Here. Sorry.
Ms. Sorg.
Here.
Mr. Sullivan.
Here.
Ms. Torpinian.
Here.
Ms. Genter. Here. President Dirks.
Here. Ladies and gentlemen, at this point in the meeting, we would entertain any public comment. If you do wish to address the board, please come up to the podium, give us your name and your address, and please try to restrict your comments to 3 minutes. There are 3 people signed up already, so I'll call them first. Ann at Demnitz. And please excuse my throat. I probably shouldn't even be here.
Hello, everybody. Can you hear me okay?
Yes.
My name is Ann Adamitz, and I am a parent in the school district. And I'm also the acupuncturist at Stoughton Hospital. And I also teach yoga, and I work a lot one-on-one with people, with adults with mental health as a preventative using mindfulness and meditation. And I speak on this topic quite widely. And I wanted to speak today to the benefits that I've received at Sand Hill Elementary. My son started out actually in private school in town here, and I really feel like that was a mistake because I thought it might be better. And when I came to Sand Hill, I realized really quickly that my son was having issues, thanks to the teacher, with attention. And they brought it up to me in such a kind and conscious way, and really quickly helped us identify that there were really specific, measurable details that my son needed. And because of the early intervention that he gained, he immediately, we had talks with the teacher, and then we came to Kelsey Debovic, who's a psychologist there, and she helped us cultivate a plan. And in that plan, we immediately started to get to work. Our insurance, and we have excellent insurance, okay, but we still couldn't find a mental health professional for young kids. It's not very often that you can find a mental health professional. That is why this educational psychologist in the grade school is really important. And they helped us get this early intervention right away, and with the help of also the support team, Kelly Stewart, they would come in and help and pre-teach with John. And the way that they do it now is to come right into the classroom and do it. And so John was not ostracized. He didn't have that feeling of in needing something special outside. He didn't even realize that there was an issue. And so through the years, it's been increasingly awesome to have an IEP, and this support that we have gotten. And as a mental health professional in terms of preventative and meditation, I see adults constantly with anxiety and depression and all of these things. And to go into the school and learn it from the perspective of these teachers who have this expertise, it's a different ballgame than what adults deal with. It's a really specialized thing to have a child psychologist on staff. So I want to say that when we went to the Wiseman Center then to get a diagnosis of ADHD for my son, when I showed them the materials that were given to us and all that has already been done for my son, they were like, whoa, they should have written the book on this. This is amazing. We haven't even seen a school like this. My sister has kids in schools out west of here where I grew up, and they don't even have IEPs. They don't have this kind of resource. So I can't say enough to you about how important this has been for my family. My son is thriving. I used to have to pull him out of the car to go to school, and now he's like telling me how excited he is to go to school. And this is just, I mean, to have a happy child and to have a learning child, this is what we're all striving for. So I can't say enough about how mental health is part of the wellness and working with adults in our community. I know that 90% of doctor visits today are because of stress. For adults, 90% of doctor visits are because of stress. And these are preventable things. I'm in the industry of prevention. So I feel like at this stage of the game, when we've got young people and we've got experts, not people who are not trained to do this, but experts who can meet us right at a crisis standpoint, this is right where we need the people. And so I can't say enough about what it would mean to keep Kelsey DeBevick where she is at one of the most thriving schools in the area, first of all, and then also to say that Sandhill has been extraordinary. Even if this wasn't a meeting about that, I would say that Sandhill has been just tremendous in every way for us. So I want to thank you all for your service and to thank Sandhill for what they've done. So thank you for your time.
Thank you. Jonathan Doherty.
Good evening. I'm here to follow up on the issue of school psychologists and the board's process for making decisions about it. Considering the number of important questions that the board raised at the last meeting and the week-long break that we had in between, I'm surprised that the topic has been placed as a discussion action item on tonight's agenda. The board understandably requested a lengthy presentation of options tonight. This evening is therefore essentially the first full discussion of the issue, and the ACA would ask that no vote be taken tonight so that the board can adequately gauge parent, student, and staff reaction and opinion on these matters. Terminating position and or adding 3 new dean positions is a serious decision that should outweigh the need to quickly post any job openings. The SAA would also like to reiterate our support for not only maintaining the current number of psychologists in Stoughton schools, but also increasing by 1 to fill the empty spot at River Bluff. If there is enough long-term funding for appropriate salaries for deans, and if the board is convinced that deans of students are indeed effective, and if there is a clear job description, the SCA asks that a dean also be added at River Bluff. Thank you.
Thank you. And Kathleen Hipke.
My name is Kathleen Hipke. I live at 9921 North Tolles Road in Evansville, but have the Stoughton School District. I am a clinical psychologist, child and family psychologist. I am a parent of a child at River Bluff, and I'm also an administrator, a healthcare administrator. I'd like to also say how grateful I am to the district and to this group for supporting school psychologists. My son has benefited greatly. My son also has an IEP for learning disabilities, including dyslexia. I do believe that the reason he is thriving is largely because of the school psychology services that we received during his time at Fox Prairie, which notably is considered very high level because of the cross-categorical model. My son never felt that he was pulled out, ostracized, made to feel different, or separated from his peers. It was remarkable to see the way services were provided. I also believe that in his incredible anxiety going to middle school with learning disabilities, that the most critical thing that has happened for him was the school psychologist at that time, Jody Peter-Schmidt, offering a bridge to him into that campus, a familiar face, support, and someone who really, really understood his needs and how to translate that to the staff. I am here to speak, obviously, about the school psychologist issue. I'm really concerned about reducing it. I mentioned I'm a psychologist and an administrator, so I understand the value of both roles, and I know that change is hard, but my biggest concern is that as I've been following this conversation, if we are going to reduce school psychologist time and put in administrative time instead, I'm grateful to this group for asking the questions about what would the training and the skill set be, because I believe that school psychologists provide programmatic development for mental health care in our schools. And that's at a preventive level, and it is also at an intervention-based level for kids who are struggling either with learning, emotional, behavioral concerns. So my big question, and I guess I didn't know it wasn't on the agenda until now, is how are those questions being answered if we are going to bring in administrators instead of school psychologists? Do they have the background and the training to think about mental health at all layers of a campus, and how we need to have staff trained, and how we support the learning strategists who are backing that up, and how are we reaching the students at different levels of need before their issues become highly problematic. That's what a school psychologist is trained to do, and to support the others like the strategists in the team group. And so I hope you'll continue to consider this question and continue to ask good questions about the training if we are to make a change. Thank you.
Thank you. Is there anybody else who wanted to address the board this evening? All right, thank you. Next up is the legislative update, Donna.
Thanks, Scott. So I've included the regular old report of things that have happened. At our last meeting, we passed a resolution for school safety that I sent right away the next morning to all of our legislators, including the Assembly Committee for Education, because they were having a special meeting about it. I actually heard back from, Gary Hebel actually called me, Don Brunick and Representative Spreitzer and Clayfish. I'm sure we all know in the news what happened. They passed the 100 million school safety bill, which is not what we were hoping for, but at least they did make some changes, and so I'm just hoping that we can keep a dialogue going and with our legislators as far as what we're going to do. I'm hoping that we apply for some grant for some of that. After I submitted the report, WSB came out with something on the school board elections and referendum questions that are on the ballot for tomorrow. So I'm just, in case you didn't know, 4 of you, there is an election tomorrow. Unfortunately, we don't have a referendum on our ballot, but it is pretty important to 13 school districts around the state that if their referendum fails, they are not going to be allowed to try again for a period of time. And it's pretty crucial that they pass. The other thing that just came in after I sent that in was that the Assembly, or the Act 142, the TEACH grants, Technology for Education Achievement grants, they just sent something out today that they've got 1.5 million available and they're taking applications until May 4th. So hopefully we can get in on some of that. And then April 9th, there's going to be another Blue Ribbon Commission hearing in Fenimore. And it's a little bit more of a formal program. They're going to have some speakers, and then they are going to open it up to public comment. So I feel like we're going to be represented in that at that meeting. And that's all I have.
And then if I can piggyback, Donna, on the referendum act, an unforeseen consequence or legal interpretation by DPI and their attorneys is the way the law was written not only prohibits districts from the number of times they can go to referendum, but it also prohibits or limits the number of questions they can ask at any one time to 2 questions. And just because of the legal definition of referendum and how the statute was written. So that's something that they're also working at, getting clarification and getting it changed, because right now if a district, sometimes your districts will go on with 3 questions. Building this, building a pool, increasing the operational budget to operate that, and now by the legal interpretation they can only ask 2 questions at once.
There's one other thing. Some of those districts, they aren't going to get their sparsity aid in addition to, so they're actually going to be even worse off than had they not had the referendum question at all. So it's kind of a problem for those 13 districts. So I hope that everybody in those communities understands that. But we'll see what happens after tomorrow.
Any questions?
Do you have any idea exactly about the referendum, what was the referendum question about the treasurer, the state treasurer, and how it affects the school, because there's something going on?
Well,
I don't know.
there is some kind of a linkage, because with the school, if the school treasurer that position is eliminated, then the lieutenant governor then becomes a board member, I think on that BPCL or whatever the commission, which I think I talked about a while ago, that the libraries and school districts benefit from the money that is made from that. And so if that is eliminated, that's just another way to try to keep that money, I think. I mean, that's only my personal opinion. We did get a WIS tax publication about that, I think about a month ago. It was pretty good. It explained all the states that do have a treasurer position and the states that don't. So if you still have that, I'd pull it out. But it seems like there's, it's just going to remove another obstacle for them to get at that money or to do something different. with it.
Thank you.
Steve?
Yeah, Donna, thanks. In your update, there was a little paragraph from Attorney General Schimmel that although a grant application process for the school safety money isn't completed yet, if there's a school district that's interested in money, tell us what your project is and your time frame. So would we pursue that related to the cameras?
We are.
Okay.
We actually are discussing that, and Cal and Paul are going to send a letter of our interest in securing funds.
Okay.
We actually talked about that today and getting that ball.
Excellent.
I know that school safety coordinator position was appointed today.
That's right.
Yeah, they just announced it.
An interesting choice. It's someone who's a school teacher and also in law enforcement. So we'll see what happens there.
Other questions? Okay, thank you. Next up, Dr. Onsager's report.
Thanks, Scott. Have a couple things. First of all, I'm passing around, this was an insert in the latest In Business magazine. This was a collaboration between the city, the chamber, and the school district promoting Stoughton. It was also the issue that it was the 30 top people under 30 in the Madison area, so it's read widely. Stoughton Trailers was also featured in this issue as a great place to work, but this was the insert that we worked together. There are ads from different organizations. There's including an ad in there from us on our healthcare program, but that was a joint effort between the city, the chamber, and the school district to promote Stoughton and what we're doing. I have two other things. One, tomorrow, the Sons of Norway Lodge is sponsoring their annual field trip for our students to learn about Norwegian culture. They do a little bit of rose mauling. They get some food. They learn about a little bit of Norwegian culture. So if you happen to be around, stop in at the Sons of Norway Lodge. Tomorrow we have all of our elementary students, or all elementaries are sending grade levels over there. And then the last thing I have is if you're free on the 6th or the 7th and looking for something to do, River Bluff is presenting Shrek the Musical at the auditorium at the high school. So if you're looking for a fun family event, tickets are available at the door for Shrek the Musical put on by our middle school students.
All right. Questions about any of that? Thank you. Next up, the consent agenda.
I move approval of March 16, 2018 regular board meeting minutes. I move approval of the March 15th, April 17th, 2018 check register as presented. We would like to say thank you to the following individuals and groups and move approval of their donation to the district. A check from Stoughton Football Incorporated for $2,166.43 to be used for football uniforms. A check from Stoughton Lacrosse Club for $1,776 for lacrosse uniforms. A check from Stephen Christensen for $1,000 for nursing scholarship. A check from Canon Automotive for $1,000 for the Norwegian dancer trip. A check from First Lutheran Church Endowment Committee for $601 for meals for students in need. A check from Erin and Mary Brust for $414 for Norwegian dancer trip. A check from Paul Rosowski for $350 for football apparel. A check from Donna Terpinian for $50 for Stoughton High School England France trip. And related cash donation budget adjustment for $7,357.43.
So there's been a motion to approve the consent agenda. Is there a second?
Second.
From Steve. Any discussion?
I have a question.
Sure.
And this is just this has no bearing on my vote, but I'm quite curious. So we have the Stoughton Football Incorporated and the Stoughton Lacrosse Club. So is it fair to say that they're not like 501c3s that are fundraising arms for our athletic programs at the high school? Or are they involved in other?
They're the booster groups for those
Okay,
athletic
okay.
Organizations.
But they're separate entities from the district?
Correct.
So we have no oversight over those?
Correct.
Okay.
Other questions? All right, all in favor, please signify by saying aye.
Aye.
Any opposed? Any abstentions?
I abstain.
Thank you. And then next up, a presentation on our tag program.
So I will introduce, Judy is sick today, so we have Chris Keenan, we have Laura Borsnick, and we have Chris Weimer, who are going to present on our meeting students' needs through co-planning and co-teaching at advanced learning. So I will turn it over to them and let them make the presentation.
Thanks for having us here this evening. I was elected to go first, so we'll get the ball rolling here. I am Chris Keenan. I am the Elementary Advanced Learner Coordinator, and we are going to focus our attention tonight on things that have been changing a little bit in our world and looking at co-teaching and some coaching, instructional coaching within our positions. So for me, what's changed is my schedule this year. In the past, I've gone to a different building every day, so I would pack up at the end of the day, go to a new building, and I would be at each building a day and a half each week. So we looked at that and we thought, well, is there a better way for me to have better connections with teachers and with students? And so last year I piloted with a specific teacher and, well, not specific, but a teacher. And so I spent several weeks in her classroom, still only a day and a half a week, but I stayed in her room 3 hours of the day just to try that on to see what that instructional coaching, co-teaching was like. So we did co-planning. We found that it was very, very beneficial. Had a greater connection with students. I was able to reach those advanced learners in those classrooms that I worked with her, and had a better feel for what they really needed. And so this year we decided to look at my schedule and we changed it up even more. So instead of visiting a different building every day, I'm spending 4 to 5 weeks in a specific building, and I'm being paired with classroom teachers. And so I still visit the other 2 elementary schools that I do visit, but I'm only there a half a day a week. And then after my 4 or 5 week rotation, then I go on to the next building and do the same thing. And so have found a lot of benefits with this. Again, the connections with teachers and with students, and the opportunity to do some greater co-planning and teaching with those teachers.
Good evening. I'm Laura Borsnick. I appreciate the time, the opportunity to get to come back again. As Chris said, we're really focusing on thinking about how we can use the FTE that we have in our Gifted and Talented program to really maximize what we do. We obviously can't be in all places at once, so we're really focusing right now on using our time to build capacity and to make the connections. Staff know that we're here, but it's easier to reach out and bounce off ideas if you really, have the time to build that relationship. So what that looks like at River Bluff Middle School right now, co-planning and co-teaching, Principal Gates started this year with what she calls designing to the edges. So really using our planning time in a really conscious way to think about how are we meeting the needs of all learners and what do all learners need. We have great teachers who are coming up with great lesson plans, but then we need to think about, will that lesson plan really meet the needs of all kids? So we have set times where our English language learner staff can come in, our special ed learning strategist staff can come in, I can come in, and we can co-plan with those teachers. And that time is set up so that they have the expectation that we really use the expertise in the room to really make sure that those lessons reach all learners. It's been a great opportunity, like anything that's new. So some folks are ready to jump on board right away. Some kind of watched to see how it rolled out. It isn't that the teachers aren't planning their own lessons like they did before, but it's really having that intentional focus on what are the strategies that we need to reach all learners. And that has provided me a set time where people know that they'll be meeting with me, and it's changed the nature of our conversations, and it's been a really effective tool. The other thing that we've really been working on building capacity, I think I've mentioned to you guys before, is planning for how we provide reading instruction to advanced learners. I've been working really intentionally with Sarah Miller. She is currently a 7th grade reading teacher full-time, and looking at how can we create a structure where it isn't just me providing the instruction for the advanced learners and kind of removing them from having the classroom interaction. We've been working for a number of years on I provide instruction, but the kids are in the classroom, and how do we make sure the teacher also knows what they're doing? So she and I have been really working on how can we kind of grow that co-teaching model where we plan together, and we plan very intentionally, when do I need to be in the classroom, when do the kids come to me so that we can have a small group conversation, when can I come into the classroom and work with other kids to release her to work with some of the advanced learners, and come up with this really partnership that is very fluid and flexible, and it's worked really, really well. In fact, I just found out on Friday that we will be presenting at the National Gifted Conference next November on this planning model, and so we're really excited about it. Our 8th grade reading staff are picking up on some of that. We have a full-time reading teacher, Jess Fetting, in 8th grade, who is like, count me in, trying it out. Other teachers are as well. Certainly we have the luxury when we have a person who's a reading teacher full-time. It's a little easier to do that when we have somebody who is teaching a content area all day and reading 1 hour of the day. It's a little bit harder to find that planning, but the teachers have been very willing, and so I'm excited about how that's growing. The other thing I just wanted to share with you, I've also talked with you before. I came and talked with you a little bit about the Javits program, the DPI grant for expanding excellence and recognizing our excellence grant gaps that exist. The report card just came out for Gifted and Talented Services for Wisconsin, and overall, Wisconsin had about a B or a B minus for gifted education and services, but in terms of our excellence gap, we have an F, which probably is not a surprise to anybody across the state. So our Javits grant is going to be wrapping up this spring, so we have one more meeting, and at our meeting we're going to be looking at how do we roll out an action plan, and it's going to be involving going out to districts, possibly through CISA areas, but going out and providing some modeling and some education and professional development. And we're going to be looking at how we can provide pilots around the state on some of the work that we've been doing and the work that's been seen in Milwaukee, Racine, and Kenosha. And they are interested. I mentioned previously that we were starting a pilot here in Stoughton area schools, and for a number of unfortunate reasons, we went through the planning stage and then kind of hit a wall when school started due to some teacher reassignments. But Ms. Singletary has suggested that she would be very happy to support summer curriculum time again, to put out the offer for a pilot again for next year, and the DPI is interested in looking at the model we might use for that to roll out to other school districts. So that's very much a co-planning and co-teaching opportunity as well. So thank you.
Thank you. I'm Chris Weimer at the high school. It's kind of funny that we all came in here with this co-teaching thing, but we got to talking at our meeting and realized that was one of the things we all had in common this year was more of an emphasis on the co-planning, co-teaching. So I thought I would talk to you folks a little bit about what I've been doing in iSTEM, which is our 9th grade science class at the high school. It came out of a couple different things. I had been working with Cindy Carter in the science department about making accommodations for advanced learners in the 9th grade within the context of the iSTEM program. And we talked about what opportunities were there, getting kids prepared for the upper level science classes, making sure that everything was appropriate for the students who were there, making sure that, everyone was engaged, just excited about science, and that was a focus. And at the same time, I've been talking to Brad Ashmore at the high school, and he had talked about that he would really want more of, to get some of the iSTEM kids into the Fab Lab, to do some Fab Lab type activities that might work with the learning targets for science. And I had been thinking about both of these things, and I said, well, this would be a good opportunity if I could spend a lot more time, if I could focus this second semester on iSTEM. So I've been working with both the iSTEM teachers this semester. I've been in the classroom every day with them, co-teaching, co-planning, working with the actual iSTEM students and staff to not only work on accommodations for the future, but also to brainstorm ideas on what would be appropriate things, what would work really well next year for getting kids into the lab, which would actually meet a goal, working with making sure that students were engaged. Many times it is stressful for the classroom teacher, even excellent classroom teachers, to teach to all levels in the classroom. And sometimes quiet students get left behind. And that's something that we work really hard to make sure that we're meeting the needs of all the learners. And that's one of the nice things that I can do while I'm in there, is say, is this lesson meeting the needs of everyone? And if not, how could we change it? And instead of me saying, you should do this, it's a much better approach if we can talk after we had the class and say, well, I noticed this, what did you notice? And have that discussion and talk about how to change things in the future. And it's been a very positive experience. It's been something that I've really enjoyed. And I think it's going to have some really good outcomes for the kids in our 9th grade science classes. So even though it wasn't really a concerted effort to do this, this is definitely the trends of where we're going as a district. And we decided that that would be a nice thing to sort of sample. And we're talking to you folks today. And I know some of you visited the Fab Lab earlier. If you had a lovely experience, I'll take all the credit. If not, you can blame Mike Connors for that. He did most of the work. But if you have any other questions for the three of us, we'd be happy to answer them at this time.
Questions, anyone?
Well, I guess,
Steve?
Laura, I'm kind of curious, you mentioned a little bit about the pilot for the Javits pilot not moving forward. How do we, if we really think there's value in doing that, how do we put assurances in place to make sure that roadblock doesn't occur again?
That's a great question. Let's see. I think part of it might be we started with an extremely small sample size. I mean, it is a pilot. There's always that kind of, that fine balance point, right? We started with 4 teachers who volunteered. That was self-selected, which is an important thing. We want people who are excited about it and on board and willing to put in that effort. And there was no way to foresee. Fonda, for example, was reassigned to a teacher mentor position. So you're asking a great question. I think we need maybe a little more than 4 people. 6 might be ideal. I think we're going to probably at least hit a 50% point. If we have 6, we had 1 of the 4 left and just weren't quite sure. We really wanted people who could bounce ideas and share their experience together to brainstorm. We could maybe have moved forward with that one, but so we're looking at trying for 6, and poor Fonda will probably be off the list because she may well end up in a mentorship position. So I think we're just going to try for 6, and whoever we get at that point, if it's 1 or 2 teachers, I think we need to move forward with it and not delay it.
Thanks.
Thanks.
Anyone else? All right, well, thank you, all 3 of you.
Thank you.
And then a presentation from the Wellness Coalition from Cindy.
Hello. Along with myself, we have some other members of our Wellness Coalition. I'm Cindy McGlenn. I'm a City of Stoughton employee. I'm the director of our senior center here in town. The Wellness Coalition has been around since around 2006. It was a collaboration with city, hospital, and school to look at healthy events, projects that we could sponsor. So we started there, and throughout the years, we've been very successful in looking at community assessment, the hospital's always been a great place for that, school as well, looking at assessment pieces and go, how can we help? We started our med drops around 2006, 2007, so we do those twice a year. Our next one coming up at the end of April. So drop off all your unused medications. We also take sharps at those as well. So we started there. We collaborated to get the, if you miss our drug take back day, there's always a box at the police department that you can drop them off anytime. A little plug for that. So our mission was to promote healthy life choices, or lifestyle choices. So that's where we started. We had a great opportunity 2 years ago to be mentored for a drug-free communities grant, and we applied, and we were very fortunate for a small community to receive the grant. It is just over $600,000 for 5 years. So we are looking at, and much of the planning that we did for the 2 years was to look at the areas that we could concentrate on. So for the grant that we received, most of it is about reducing youth substance abuse. So we have, now I can look at this. I'm going back, there we are. So with our Drug-Free Communities grant, we expanded our membership, looked at these 12 areas in our community, and to get representatives from each of these. So looking at different perspectives, different expertise. So that's where we are with our Drug-Free Communities grant. I think a copy of the work plan was included in here, so I'm not going to go over those. But we have strategic framework. A lot of you are familiar with this. Looking at capacity, planning, implementation, and then having those evolve. So when we talk about some of the assessment pieces in our community, the YRBS that the school does every other year, correct?
Oh, yes.
Yes. So we're looking at some of those. The 2016, sorry, there we are, from the YRBS of daily usage of our youth using alcohol, cigarettes, marijuana, and prescription drugs. So we want to keep track of this. The 2018 info is out currently. We're working very closely with, help me where Sarah's from? Dane County Public Health, thank you. And those numbers are going to be shared at, we have an open house on April 24th, so we'll be sharing that new information. But when we were going through and applying for this grant, several services came in and helped us do some focus groups in the high school. And what we found is that, obviously, yes, we have use of all of these with our youth. Some of the things that concerned us as a group were, there's a lot of self-medicating. I'm bringing alcohol in a water bottle to school. I'm smoking pot at lunch, to self-medicate. So what that tells us, or what we decided to concentrate on as well, not just our money that we received for the prevention piece, but that we wanted to, from the Wellness Coalition, take that a step farther. Looking at mental health, looking at anxiety and depression, and how can we do some preventive work there outside of the grant that we received from the Wellness Coalition piece, looking at how can we look at that mental health piece. We saw it in the information that we received, so we want to look at that prevention piece going earlier and earlier. Are there programs and events that we can sponsor within our elementary school and River Bluff to look at the high incident of anxiety that our students are showing. So that's a piece that is very important to us. We're looking to promote mental health first aid within our community, so we'll be looking at that in the next year or so as well. So as I said, going back to our Drug-Free Communities grant, underage drinking was our first, oh, Becky, it doesn't like me now. I'm darking back, right? There it is. So our first challenge, obviously, underage drinking. Looking at the, limit the accessibility and availability of alcohol. We'll be collaborating, again, with our key people, looking at, with our police department, looking at compliance checks, and as we were, again, going back to that YRBS information, a lot of the kids were telling us where they were obtaining alcohols in their own home, sneaking it out of their own house. Mom and dad maybe didn't see. So we're also looking at some fridge locks for parents to have for their own home. Our second challenge is prescription drug. Obviously, we talked about that, and so we were looking at the Dose of Reality. Our drug take-back day is April 28th from 9 to 11 at the fire department. You just drive right through, drop off your stuff. It's very easy. We also have lock boxes available. The senior center, our EMS, our ER. Teresa also has them at the high school for any parent that wants one. So these are medication lock boxes that we can provide for free. Also, the Wisconsin Prescription Drug Monitoring Program, making sure that all our healthcare providers are signed up through that. So, the Reality Maze, which is very exciting. This will be our second annual Reality Maze that we'll be doing at the high school this Thursday. We were fortunate to be able to do this last year. I actually had a freshman last year, so it was very interesting to watch he and all of his friends go through this, knowing some of them. So every member of the freshman class will go through the Reality Maze. They receive a scenario when they come in the door. It's held in the field house, and we have great representation of actual organizations that deal with some of the consequences of this scenario. For instance, you may first start at the party table, and you decide that you're going to partake in that, but then there's a consequence. A lot of the party table then has glasses. They have glasses that impair your vision of maybe you've been drinking, you've been taking prescription drugs, or you've been smoking pot. So the party table then shows your loss of dexterity to talk about, you know, could you drive? Could you make good decisions in that? We have great collaboration with our EMS in town, so if one of the consequences is that you drove after you'd been impaired and you wreck, now you have, not only are you going to the hospital, but you're also going to talk to police and see what those consequences are. So each scenario, it's different. It's not all drugs and alcohol. There's some of, my son, for instance, had shared let me get this right, had a girlfriend, had a picture of her on her phone. They broke up. He then shared the image with someone else. This was a scenario, not actually what my son did. Let's just be clear there. Sorry, Sean. But so then shared that with someone, and now he's a registered sex offender. Again, just the scenario, not my son. So there's a lot of really great conversation that happens. We have wonderful volunteers that as they go through these stations, when someone goes, okay, so now you're a registered sex offender, they're like, what? So a lot of great information shared and some good things to talk about. At the end of the Reality Maze, they then go through a questionnaire of what they learned, and then also are then taught refusal tactics. So let's say you had this scenario in the front. What could you have said to stop your behavior before these things happen? So a lot of really great information. It's really interesting to watch. If you have time, if you're in the, in the area, we welcome you to stop in, experience what the kids are doing, and really get an idea of what we're trying to give good information and do some great prevention work. We have 3 of our other members here, Becky Felstead, Kelly Milker, and Teresa is our worker. She's in charge of it all. So if you are interested in asking more questions, or if you have ideas for our group, this is all the information. We also have a Facebook, and check out our website. It's brand new. It's very nice. But check that all out. Do you have any questions about the reality maze or what we do?
Very interesting. You said that you have these services for parents, like the lockbox and some other things like that. Do they know about it? Do they?
We try to communicate as much as we can community-wide. I know that Teresa has. We've been trying to get information in the the emails that go out to parents. So as much as we can. I know with our EMS and our ER are dealing with parents who are in the middle of it. So thankfully their child is okay. But if this is a problem, let me get you one right now. So they have this at their availability. But yeah, if there's any parent that wants one, and actually from my perspective, any grandparent who wants one, it's very important, because grandma and grandpa might not miss 2 OxyContin out of a bottle. They're not going to take the whole thing. But so it's just something to be preventative, another preventative piece.
Yeah, I was wondering exactly how you guys are marketing that.
Yep.
I mean, it's only through emails then to the parents, or how other people from the community that do not have kids in school?
We advertise it through the senior center for all older adults, so that's advertised there. When we do our Med Take Back Day on the 28th, those will be available for people to take then. So we try to do that.
My last question was, what grades were participated in the reality maze?
A freshman, whole freshman class.
Okay.
Yes.
Thank you.
Done. Oh, sorry.
The YRBS data, I know it's out, so, is there any, I know it's being analyzed right now, but any sort of takeaways from like what they're looking at, that, some striking,
First of all,
issues?
I would like to say Dane County Public Health has been a wonderful partner that we have kind of connected with the Drug-Free Communities Grant. I know that they've periodically worked with us before, but they've been a great partner in doing this.
Yeah, Dane County Public Health actually just created a new position about a year ago right now, and the person that they hired ran a drug-free communities grant in Rock County for the last 5 or 6 years, and her job is to help us do this well. So she's actually joined our coalition and did take on analyzing our community's data from the Dane County Youth Survey. It's interesting, the topic tonight that had a lot of public comment, because one of the pieces that has shown really growing concern across Dane County and all the high schools and middle schools that do this survey is youth mental health, and big jumps in anxiety and depression and reports of suicidal thoughts. And several schools are really doing some drill downs to look at that more closely. So one of the pieces that is really moving forward in a number of districts, and including with our data, is looking at that increase in the mental health criteria as compared to substance. And for the percentage of those kids that are showing an increase in mental health concerns, what's happening in the substance realm, so that we can kind of get a look at where there might be some good opportunities to jump in. So that should have a good culmination of that in terms of the big picture for Stoughton in the next couple of weeks, and we plan to use it as part of the presentation, and actually the framework for our presentation for the town hall meeting on the 24th. So, and you'll all be getting flyers about that soon.
One other question then, thank you for sharing that. You talk about the prescription drugs, and that's, you know, sort of the gateway into heroin. So, I mean, is that, are you doing anything as far, I mean, I know that's more of a older than you know, kind of the 18 to 25 and even older, but I'm wondering if there's anything that you are doing specifically addressing heroin use.
Well, really looking at, because we're about prevention, when, you know, to have conversations about safety of medications, there's actually a great piece that we're going to be hopefully using in our elementary schools. It's called Generation RX. So we'll be looking at how to talk about, you know, medication safety even then, but looking at having a conversation, and it's a tough one to have about pain management. We're a society who likes to have no pain at all. And so when we're talking about resources for parents, you know, on our website, of when, you know, just for instance, when you're having a wisdom tooth out, you don't have to take OxyContin. You know, you can do Tylenol. It's okay. Everybody's going to be okay. And so it's those conversations of prevention. Not, we're still looking at the crisis in our community. We're not saying there isn't one, but with our grant, we're looking at preventative pieces. So how can we get more information and resources out to parents about prevention? And so we don't maybe make a dent in that crisis piece by doing some really great prevention work in younger and younger students. Anything else?
I would just add that, you know, I think it's becoming more and more known that this is not bad kids, you know, looking to get in trouble. This is curious, normal, brain-developing teenagers who are influenced and are curious and have absolutely no threshold for being dared, you know, and that we need to alert parents to what are some of the common things that go through their minds and what they do with that, and limiting access and creating more awareness around that. You know, in addition to substance, there's a lot of other hazardous things that kids in this age group are doing, and they're not thinking about it being dangerous. They're thinking about the thrill and the fun and how cool everybody was going to think it's going to be. So that's more in knowing where our kids are and what they're doing and what they have access to. Knowing what pills are in your cabinet, you know, and why they're there, and if they don't need to be there, get them out of there, because that's just an unneeded temptation. Yeah. So, you know, and there is a lot in the media about that as well. So anyway, it's more that awareness of these are things that happen, and what can we all be doing about it?
One other question, when you said something, as far as the availability, I mean, I know that you and other groups have worked with retailers in the community. Is that still something that's part of your approach? I know Walmart has the separate room, but now there's the Aldi. Is that they're selling something, and then the delivery and pickup. How do you keep abreast of all of those things going on, and do you have any involvement with trying to shape some of that policy?
Yeah, we, again, with city, school, hospital, the police department has been really open to collaboration, and so we've been really pleased with that relationship. But Teresa attends all the safety committee meetings.
Yeah, the Public Safety Committee, where things like click and collect, including alcohol, come up, and I'm not on the agenda, but I'm frequently asked or looked to. And I will say that actually the city was great. It was really plugged to them that your Walmart could be the first one where people could get their liquor at a drive-up, and they really cut it down.
Good.
And was like, yeah, we don't want that precedent here, you know, and really talked about the challenges with what that brings. And so and that no business in Stoughton would be having that, so.
That's really
You can get
neat.
your groceries that way, but now you're alcohol.
Well, and I think that's really what we're about, is having resources available, best practices that we can share. How can we, provide funding for a workshop that a teacher wants to attend, working with the SRO, and are there trainings that he may need that our grant can, help him attend. So it really is about relationship, collaboration, and resources that we can provide.
Yeah, this resource is for the community as a whole, and actually, today, our director of the ER and our narcotics office with the police department started a week-long national conference on prescription drug and heroin abuse, and they're in Atlanta right now, and that's,
And that was funded through our drug-free communities.
Yep.
That's great.
Yep, so
Thank
all the
you for your
travel,
work.
all the registration, all of that, so that's the sorts of things that we're looking at. How can we enhance what's needed in this community and maybe build on in the time frame that we have this, and it's across all the sectors.
Anybody else?
Okay.
Well,
Right.
if
Thanks for your time.
Thank you.
Have a little time on Thursday, stop by the high school.
Yep, we'll see you
And
Thursday.
then our open house on the 24th, and drop off your medications on the 28th.
And if you're curious, ask Frank or Scott next week, because they're gonna help
Oh,
us.
nice.
Yeah, rerouting these too.
Yep, thank you.
Thank you.
Okay, next up, Safety Committee update.
Thank you, Becky. Good evening, everyone. I'm Calvin Morath. I'm the Buildings and Grounds Supervisor and the Safety Coordinator for the district. I want to thank everybody tonight for your time, so we can give you an update here on what the District Safety Committee is kind of working on. We'll start out just a little bit with some history. In 2015, the district as a whole decided that we're going to work diligently on upgrading some of our different safety and security features throughout the district. During every 3-year audit, we discovered that there was multiple layers of things that we needed to bolster or add to our current safety protocols. You'll notice many of them in our buildings today, such as radios. That's kind of more of a behind-the-scene thing, but when you're managing a crisis situation or whatever it may be, communication is critical, so you can't necessarily rely on cell phones, so we upgraded our radio system. Rapid Visitor Management is electronic visitor management coupled with a background for a sex offender check through all 50 states registry. We have secured vestibules. We added signage throughout the district to make sure people were coming into our buildings in the right locations. We've done some tremendous work on having people wear ID badges, because when things strike, you need to know who is an adult, who's not an adult, who's with the district, who's not with the district. We've talked several times about cameras, and we're going to talk a little bit more about cameras again in a little bit. We reconfigured our emergency plan manual to a digital format that's accessible across your iPads, your computers, your telephones. You don't need district network to get it. You need a cell phone reception. You can use the district Wi-Fi, and we also have bolstered that with some hard copies inside the facilities that are updated on an annual basis. We laid out plans for reconfiguring that manual, so we go through different sections of it on a yearly basis, and we take those to the District Safety Committee for those annual reviews, and we also implemented ALICE framework for our active shooter response. Speaking of that, we'll be talking a little bit more about that as we go along, and I know it's kind of a hot topic right now, unfortunately, due to recent events. So at our district meetings, we hold those at our all administration meetings. They're held generally about every 8 weeks. We have our directors and all of our administrators there. We also have our SRO, myself, our school nurse, and our custodial operations supervisor. Our next meeting is on April 18th. What we've really been working on a lot in the last year and a half is that ALICE concepts. We're also working on overall safety improvements, and we'll talk a little bit more about some of those as we talk about the ALICE 2.0 list and our ALICE subcommittee. Our building teams host 3 to 4 meetings annually. we have created some recommended agenda guidelines that were reviewed by our building administrators so that we can have a kind of a framework there. Some of the things that we're doing is a tabletop scenario, in case not everybody is aware of what that is. It's a walkthrough of an event based on a time and verbal response. So you can play out a spill of material from a semi-tanker outside of a building. You can play out any type of scenario you can dream up, and you can go and have an emergency response team or even your building occupants kind of discuss and talk about what's going to happen and how you're going to respond to that. So it opens up great dialogue for discussion, and so we're building that into those meetings. A when-then scenario is a more simplistic approach. Again, it's to spur that conversation. So we could say something as simple as, when we need to barricade this door, then what do we do? And you can do that in any setting. You can do that amongst a coworker. You can do that amongst student to student. So part of that district safety committee is working on building those and having those be delivered out through the building level safety committees. As many of you are aware, we have worked diligently on implementing ALICE. That's Active Shooter Protocol, and ALICE stands for Alert, Lockdown, Inform, Counter, and Evacuate. And that's not a linear sequence of events. It's just a framework for a way to respond to that. We held a district-wide staff training in the summer of 17-18. We had 3 different sessions. We had 2 sessions in June and a session in August where we held a 4-hour demonstration with active scenarios. We had parental meetings in November. We had about 8 to 12 parents at each one of our sessions, and we had very positive responses from the parents who attended those meetings. We'd also received emails and phone calls stating that they were happy that we're moving forward with an active shooter response here in our district. Student rollout began in December, and it is ongoing through the remainder of the school year. And I do want to stress that it's really important that it's a continuation. It's not an all or nothing or all at one time approach. It's a continuation. So at the elementary level, they're working on they have a lesson plan that they're working throughout the school year, and it's kind of a continuation of, you go through this sequence, you go through that sequence, and it's a continuation of that. Part of that is those plans were developed by our educators and our principals at their buildings. So that is able to, they have that personal touch, that personal lens with their staff and their students, and they're able to get that feedback and appropriate those plans correctly. Our evacuation sites have been adjusted, and part of our safety initiatives through the course of the last few years, we realized that it would be a great idea for us to get out to these sites every year, meet with the people who are in charge of there, and so we began doing that, and we found some efficiencies. We were able to work on some things. We have a small mutual agreement in place with them, just stating that, hey, you're going to be there when we need you. So that's been a really good piece. We've worked really closely with Fox Prairie. We've moved that site from Cummins over to Osselsen's Hardware. And at the high school, we are at St. Anne's as an evacuation site, as well as Viking Lanes. Online e-learning is, we began doing that for long-term substitutes and community coaches. We have long-term substitutes that are in the district for anywhere from 2 weeks to, could be a semester. And so what we realized was we need to give them some type of training. And so that was kind of something that we didn't address right away, but we realized that, hey, we need to get moving forward with giving them some type of training. So they're doing the 1-hour online e-learning module, and that builds the ALICE framework and actually answers a lot of questions and prepares them for that, what our process is in the event that something like that were to take place. And then on April 13th, we have an upcoming 4K training at River Bluff. So that'll be hosted over there. That's in conjunction with our police department. So we'll be training our 4K sites, any other staff or any other administrators that want to come. I think even some local churches and community groups have some people going to that. The reason that's able to happen is because our SRO, who is affiliated with the police department, is able to provide that training. Our ALICE certified instructors cannot provide that training. However, we can assist and back up and support that. So we wanted to gather a little bit of feedback. So we sent out feedback to all of our staff to determine what they thought of the ALICE training, because this is kind of a very different approach to a tough subject. So we had 155 responses on average through each of the categories, and we asked for written responses and suggestions, and they were overwhelmingly positive. And that was really nice to see that staff had thought that it was a valuable training. Many expressed that it was excellent but an unfortunate training. And it's a tough thing to kind of sit or talk through when you're going through those different trainings. So on a scale of 1 to 5, we had 94%, I would say, got a passing grade of the staff that took the survey on how well they liked the training. We asked them, do you feel what you learned in this training will be useful at work as well as in your daily life? And that was 99% of staff responding to that said it would be useful. So that tells me and the rest of our ALIS subcommittee and our safety committee that this was a valuable training. How did you feel about the length of the presentation and demonstrations? Again, it was just fine for 94%. How do you feel about the number of participation scenarios included in the training? We did 5 different scenarios. I'm not going to lay those out because we're going to have these every year. Again, we felt that 5 was a very adequate number. Some people looked for more, and some people thought maybe 5 was too many. But for the most part, everybody thought they were fine. So as I talked earlier about ALIS subcommittee, so that ALIS subcommittee is comprised of our ALIS trained certified trainers. And we created a list of 2.0 items, we call it, and what that really boils down to is the questions that come up. So not only questions at our trainings, questions that we receive from parents, questions that we've gotten in the interim, questions after recent events. And so these are just kind of a list of some of the items that have come up and that we are working on currently. Substitutes, we have a lot of substitutes. Some are just one-day substitutes in the district. So this summer we're going to be looking at what are we doing with substitute teachers. You know, there's over 100 of them that maybe be here one time to a whole week long. And so what level of training are we going to invest in that? New staff and staff that start mid-year. How are we handling that? Well, we've decided that right now we're going to, any staff that start mid-year, we'll do active trainings with them when we go to new teacher orientation, which is coming up in August. And then during the interim, they'll get the online e-learning, such as a long-term substitute. We're working on our PA system, being able to utilize that from any phone. We kind of have some of the infrastructure in place. We're actually going to be touring another local district here in the near future to kind of take a look at some of the different systems they have in place to see if we want to incorporate some more things. Our planned rollout, again, is going to be over the summer to make sure that we can utilize our PA system. And what that does for us, again, with that ALIS, is that alert function. You know, we're able to alert and give real-time information from any phone inside the building. Stop the Bleed is a campaign, exactly as it says, it's stopping the bleed. And I'm working with Laurel Griedebeck on that, and we're in touch with the UW trauma coordinator and the Stoughton Hospital. And right now we're kind of discussing kits, having kits in the classroom, small bag of items. But in order to get those kits, we need to do some training. There's a possibility right now we're looking at having that done with CPR and first aid. So we're in the preliminary functions of that. Again, our intent is to roll that out next school year. We discussed a little bit about the radio upgrade earlier, and having that real-time communication is key if you're going to manage these situations. And a topic that comes up quite a bit recently, and we want to talk about it, but I just want to stress that it's not a decision that I can make or Tim can make or anybody can make. It needs to be a collaborative situation and discussion. Is door stoppers, locks, and bars. There's a lot of talk about put down this item in front of your door and the intruder can't get inside of a classroom. And we have that on our April 18th agenda. We're going to have the fire and the police chiefs join us. We're going to have the SRO with us. It's a decision where there's a lot of different things that can affect that. Ingress, egress, classrooms with 49 or more students in it, large areas, LMCs. You know, we need to discuss all those different options. We need to weigh those pros and cons before we kind of decide if we're going to go ahead and put these door locks, these stoppers, or these bars on there. There's other life safety codes that come into play with that. And we want to make sure that we're making the correct decision as we move forward. We don't want to do anything out of haste. And that's just going to be really important to have all those key players sitting around at that table and having those conversations. Cameras. We discussed a little bit at Facilities Committee, I believe back in January, and our intent was to issue an RFP, and we issued that RFP in February, and we had a walkthrough with 5 vendors on March 22nd, and we walked every building throughout the district and kind of talked about what our needs are. We're asking them for a design build that's going to meet our needs. And we've asked for that 100% coverage in those critical areas that we discussed at the facilities committees, such as hallways, corridors, and open common areas, places we're not putting them, bathrooms, offices, classrooms, just to name a few. We're planning for a summer implementation. At this point, we have to see where the funding sources come from. We have to be waiting for approval from you. And based on the recent school safety that was put out, the $100 million, we'll be applying for a grant from the Department of Justice of School Safety, Office of School Safety. So I'm sure there'll be more information to follow from that as time progresses and we get a few more updates. But I'm aware that there is a letter out there that we'll be putting together to at least apply for some of that funding. Does anybody have any questions?
I have been talking with some constituents and, you know, are concerned about school safety, and I explained the ALICE program. And what, you know, one of the things that they were asking about was what else we had done. I said, you know, reminded about the locked entrances, that we didn't have that before, and that the plan was to put in cameras. And the concern that I heard was cameras aren't going to keep people out. Is there, I mean, do we have data on cameras with crime prevention? Any place I can, you know, get some more resources for these folks that I've talked to? I'm kind of what, because I mean, it kind of made sense. Well, how do we keep them out? And they, you know, had some ideas about like double locked entrances and that kind of thing. And obviously, any of that would cost quite a bit of money. I don't even know if it's feasible. The short answer, and it's a tough answer, is these criminals that are doing these acts of terrorism, if you will, on schools and community-based businesses, they look for any way they can to get around whatever measures you put in place. Okay. Cameras are, how do you figure out what happened after? Right. You know, there's a small level of deterrent, you know, maybe at the high school level. Middle school, not so much. Elementary, probably not. So it's a tough answer. It's a tough question. Yeah, there's a lot of surrounding districts, as we have talked about, that have a lot of cameras. And I think a good resource would be definitely our police department. I think they're going to have a lot more analytics and data on that stuff. And in fact, I know they've presented some of that information in the past. I don't know the numbers off the top of my head.
Okay. But what the chief keeps stressing to me when I meet with him on cameras is cameras are not going to prevent an active shooter, but it could save the police department minutes in responding when they pull up, and they can pull our camera system and say the armed intruder is exactly here. So it could save them minutes as far as identifying where they go in. And as the chief said, every second counts for preventing more casualties, etc. And so that's what he's stressed to me numerous times. And it's not going to prevent, but it could be very beneficial, and it could actually save lives if they are responding to a situation.
Makes sense.
And to supplement that is, during our walkthrough, we discussed there's a product. It's a software and a camera function as well. It's called Analytics. And you know, with having a live feed to our police department, because our fiber optic network is there, they could dispatch police to the right location, and a camera can follow that person through the building and automatically switch from camera to camera. So we did ask for that feature to be at least quoted in our camera software, because as Dr. Onsager said, those seconds and minutes can equal lives. Joe?
Well, on the subject of cameras, I just think we, as a board, need to be clear that an active shooter situation is not the only problem we're trying to mitigate with cameras. I mean, I don't know if Mike Cruz wants to say anything about what other values cameras would provide, but they're more helpful for sort of less serious situations than what we're talking about. I mean, there are other things I think that would be more meaningful that we could do in terms of an active shooter situation, but that's not to say that cameras aren't going to be valuable, I think, in a lot of other ways.
Hi, everyone. Camera-wise, for us, we see the value in a variety of different ways. One, preventative, hopefully to deter people from making poor choices. The other thing is, if we have issues in hallways where people aren't and people accuse other people of other things, we want to make sure, because we had it happen last year about a sexual assault happening in this area and everything else. It took us forever to figure out if that person was even in that hallway or not in that hallway. They were, at some point in time out of class and all that kind of stuff. If we've had fire drills, or excuse me, fire alarms be pulled, the fire marshal says, I want to see who pulled that, we want to talk to those people, we have absolutely no clue what even to point them in the direction of where to go with that. We've had fires in the restroom, people setting fires to soap dispensers, and never figured out who that was, because the last person came out and said, hey, there's something going on in the restroom. We go down, we deal with it, do everything we need to do, but we don't know who the last person before that was that went into the restroom. It'd be just like that. But there was a variety of things that we could do, and sometimes it ends up after the fact that something already happened, but solving that and making it safer for everybody and making the ability to, if a student tells us something or we find out something happened, to solve that and make sure that it gets handled appropriately is very easily done with the appropriate equipment. Without the appropriate equipment, it takes forever, and a lot of the times you cannot even figure it out because it's just not there. So,
Other
that
questions?
answer?
Donna?
I have a question, but just since we're talking about cameras, I have a concern. And that is that we better have some really strong policies in place about how that data, that camera data is actually accessed. I'm really concerned about a parent coming in and saying, I want to see that footage, and then how do we protect the privacy of all of the other people involved? And so I'm hoping that we check with other schools that have done this and that we've developed some pretty strong policies. Because I'm really, that part is what really worries me. I mean, I understand what you're saying, but I just feel like the cameras are just another way to catch people doing something wrong. And I think we need to talk to some folks in the community, make sure they understand, and then make sure we know how we're going to release that kind of data, who gets to see that data, and how we're going to make sure it's safe and not going to be, someone's going to get a hold of it.
Don't we have cameras on the buses now? Haven't we had cameras on the buses for years? Has it prevented anybody from getting on the bus and causing a problem on the bus? Or is it to help solve
I don't
things
know,
after the
but I
fact?
mean, that's a good point. Maybe so this is something that I'm just saying it as we need to have something in place. So we've got some time before that comes up. I don't want to have us to figure out what we have to do after somebody, when we're faced with a situation. And that's just sort of my caution. But I do have a question. You did say who's on that building committee, or the district committee team? Who's on the building? Who's on the building team?
So each building has an emergency response team, and it's going to be the building administrator and their designees. Most of the time it's the administrative assistant, usually a health EA, and then they have just a selection of team members, and I could not quote you every team member. But we do have it listed in our emergency plan manual, so every year we send out an update to them asking who's going to be on there, so we collect all their information and we go ahead and build that into the emergency plan manual.
So is that available, does anyone in the staff then know who's their building team person? So if they had a concern, they would go to that person?
Yes, everybody has access to the emergency plan manual, and all that information is listed right in there. At their annual beginning of the year meeting, part of that plan is to review the emergency plan manual with staff members.
Okay. The other question I had was about the ALICE training. You said it's a continuation and that you're going to be offering ALICE to new employees and long-term subs. But what about just a update of ALICE training to the staff who've already had it? It's my understanding that successfully implemented ALICE programs in other districts involve a constant like updating, and I think Scott's shared with us the tragedy that happened in Parkland at that high school, that SRO didn't rush in, and lots of times it's a function of how much practice they get at dealing with those. And if you just had the training once and then you never did it again, you're not in that mode of, yes, this is what I'm supposed to do. So I'm wondering if that's part of your 2.0 or if that's 3.0.
Actually, that item is on our list, is ongoing staff training. I didn't list all of the 2.0 items.
Well, it's good to know, because I think that
Yes.
it's, you're a little bit smarter the second time you go through it and the third time, and
Absolutely, and that's a very good point you make. During our initial round of training in June, we had somebody who was not able to participate. And so in one of our scenarios, they were in the area and having gone through the training, having gone through everything, not actually having participated in the scenarios, they still had no idea what to do. So it's important to have that hands-on training, and we did have a lot of feedback regarding that, actually. Staff had sent emails, some of their spouses had sent emails stating that ongoing, that hands-on training is very important. It's a difference between knowing what to do and not what to do. Mm-hmm. So it's that muscle memory.
Okay, thank you.
Other questions? All right, thanks, Cal.
Thank you all. Have a great day.
Next up, excuse me, fees for meals, facility rental, pool program, and consumables.
I fear this won't be quite as engaging as the last couple of speakers, but alas, we are here. At our last Finance Committee meeting, we talked about possible fee changes for the upcoming school year. We take that to our Finance Committee every March. It's kind of a routine thing that we do on an annual basis. And we look at a number of different items, and we have some conversation at that meeting. And then we bring a recommendation to the board. And the goal is to have those things approved and in place by May, so we can use that information to create all of our materials for the upcoming school year. So based on that discussion, the committee ended up making a recommendation to increase the cost of breakfast next year for adults by 25 cents, to increase the cost of lunch for all grades and adults by 10 cents for next year. And then in looking at our facility rental fees and going through the formula that we use for that, to increase the rental fee for the high school auditorium by $1 for both residents and non-residents. And again, there's a process that we go through to come up with those recommendations that we talk about at the committee level. And I'm certainly willing to get into that if anyone has any questions, but that's basically where we ended up as a committee.
Questions? Okay. Thank you.
Points for being fast, I guess.
Excuse me. Next up is first reading of policy 114.
Thanks, Tim, or Scott. We have the policy committee has a new policy to share called 114 School Community Relations Policy. And there was really nothing happened that made us bring this forward other than we felt that it was important to have a policy that in place that actually mirrors what we're doing as a district to improve our community relations. So this is our first stab at this new policy. Does anybody have any questions or comments?
Does it, I'm sorry.
No, go ahead.
When, have you seen, for example, like other school districts that do a lot of different communication through the web page, but also, I don't know exactly an example, but like more communication through not only the webpage, but also like local papers and that kind of thing. So I don't know if we are exactly doing that, but I think could this be part of it? Is that?
Well, I think what it was, and while we felt like the list seems like it's pretty exhaustive, it's not. It's sort of vague. We didn't want to prescribe everything that we should be doing, but sort of more in general terms. And so I think this would be something that maybe the communications committee would talk more about, or our communications person, with Tim. We just wanted to make sure that we were capturing the thing, like in general, what things that we should be doing. We do all of these in one way or another, and some of them we're actually required to do by law.
But why is this is it going into being a policy then rather than on the book, for example? Why does it have to be a policy?
Well, I think it's a policy because it sets an expectation of what our practices should be.
And can I piggyback on that? I also think it will create some continuity between different sites and while also allowing them a little bit of freedom and autonomy, but I think it also allows for a little more alignment between the different school sites to have these common expectations.
Other questions or comments? All right, thank you. And we'll have that on the agenda in 2 weeks for discussion action item. All right, the last item on the agenda is regarding staffing recommendations. Excuse me. There are 5 possible recommendations that have been listed in our materials. Revision number 1 is that which is recommended by the administration. So in order to get the discussion started, I would entertain a motion to approve something. Otherwise, we can't talk about it.
I move we approve revision number 5.
Okay?
I second that.
All right. Thank you. So, revision number 5. Would not hire any deans of students for the 3 elementaries. It would hire or retain a school psychologist, I guess. No, hire a school psychologist for River Bluff. The net change for the budget would be $129,000 decrease. I'm sorry, it'd be $129,000 more to the budget.
No, it's under budget.
Under budget.
Sorry, thank you.
Reduction.
So, is there any discussion anybody wants to have on that motion?
So that maintains the psychologist that we have and adds 1, is that correct?
Yes.
Correct.
Frank?
So I have some concerns about this, and I'll express it as saying that we had a recommendation last time from the administrative team to add the Dean of Students positions. And as I understood the basis for the recommendation, it was to free up principal time and psychologist time from immediate crisis response so that they could concentrate more on the tasks that excuse me, that are more within their core competency. The Dean of Students, as I understood it, was intended to be the first point of contact for most of those crises. And I think the concern that many of us expressed last time was that we didn't see a good explanation of what the Dean of Students would do, of what that person would be like, or how that position would fit into the school structure. We've now been presented with that. And I think that it's important for us to give serious consideration to the recommendations of the professionals on the administrative team. I'm not saying I agree with them. I'm not saying that I'm going to necessarily vote to support them. But I am concerned that we have, that our professionals have identified a specific problem related to management of the elementary schools, have come up with a recommendation to resolve it based on their professional judgment, and that in some ways we're substituting our own judgment for theirs. I will speak only for myself here. I don't know a whole lot about how to run an elementary school. But what the people who do know how to run an elementary school have told us is that they think the deans of students' positions are worth serious consideration.
Thank you. Anybody else? Tim?
I would concur to a certain extent. I don't know that I'm replacing my judgment with the administrative team. I've heard from over 20 constituents about this issue, all in favor of making sure we do not remove. So I'm here to represent my constituents, saying we should not remove these school psychologist positions. I do think we have to address the concern that we did hear from the administrative team regarding the possible need for dean of students, but I'm not comfortable doing that by removing these school psychologist positions, and I think I made that clear last week. And so, you know, I'd be open to exploring another option that was presented to us. But we've been presented with quite a bit of research on this issue. And I myself have been a building principal. And so I am struggling to still see how reducing this position, even with the information I've been provided by them, how reducing the school psychologist position is going to somehow address the concerns that they've expressed. Like I said, I would be interested in looking at adding dean of students positions, but not reducing the school psychologist positions in order to do that.
Okay, Donna?
While I appreciate the thinking outside of the box and coming up with another, some other solution, I too have pretty serious concerns about not having a school psychologist at every site. And it seems to me that we just haven't been, yes, I would agree we are not the experts, and we do rely on our staff to be those experts. But it just feels that it came up really suddenly and that we don't really have a lot of data to support the decision. And so what I'm wondering is if we approved this revision 5, it does give us some extra money to actually spend some time to study the issue over the course of the year, and then maybe come up with a solution again in a year that maybe is more palatable to everybody involved. My only reservation with revision 5 is that I'm concerned about the reading specialists being pulled as well. It seems to me, and maybe someone can explain this to me, but I'm a little curious about the linkage or the relationship between literacy and bad behavior, or just behavior in general. And if we are seeing some problem behaviors, and somebody maybe is feeling badly about where they are as far as their literacy, it makes sense to me that what do you do when you don't feel good about that? You cause a problem. And so to pull a reading specialist, when we may not be able to get that put back into place, if we realize that we do actually need those supports, is concerning to me. And so I would say that even if we added the reading specialist back in to the overall recommendation, we're still at a budget, we're still within our budget, $54,000 under budget. And that seems to me to be that would give us some money to play with to at least study it. Or pilot this at one school and show that the data, with data that the behaviors went down and literacy went up and student achievement went up, because I'm just not convinced yet that we actually have anything to really look at, because we aren't experts. And I've said this before, what do board members understand? Graphs. And we understand when lines go up and we understand when they go down, and when appropriately they should go up and go down. And I'm not feeling that I've seen anything like that with this recommendation.
But I don't think we're getting rid of, under revision 5, we're not getting rid of a reading specialist.
Yeah, reading specialist is being decreased.
Oh, I'm sorry.
So, I mean, I would actually make an amendment to that
small.
5, but I just wanted to get the discussion going.
Steve?
So, with regard to the reading special, and I agree with pretty much what everybody has said so far about the school psychologist. I think it's important that we have one at each school. With regard to the reading specialist, this is a reading specialist who's retiring from River Bluff, and there are currently 2 reading specialists at, there's currently 3, one's retiring. Are the other 2?
There's 4 currently.
There's 4 at River Bluff?
Correct, Trish, there are 4 reading specialists currently at River Bluff.
Okay.
With 1 retaring, there would be 3, 1 at each grade level.
Okay.
The one
so
that,
are they reading specialists or reading
For
teachers?
reading teachers.
That gets to the core of my question, because the reading specialist directs the reading program. The reading teachers follow that direction, so I'm just curious
Right.
about that.
So we have 2 reading specialists and 1 reading teacher. So I appreciate you really thinking and digging in and looking at literacy. Whenever we make a recommendation, or I make a recommendation, one of the things that we do is we look at when people are retiring. Historically, with the board, it's been really important that we keep our personnel and not do layoffs. So the opportunity presented itself this year to really take a look at the how we are doing with literacy this year. And I think you heard Laura talk a little bit about what we're doing with our co-teaching model, as well as some of the data and information that I presented the last time. That even with the loss of that position, we are increasing literacy scores at River Bluff tremendously this year, doing that push-in model. So again, the purpose of not necessarily pursuing that position or eliminating it is because we're pursuing the push-in model, not the pull-out model. So it would be a little bit superfluous.
Thank you for clarifying that.
Yeah.
Just to point out, our website only shows, from what I could tell, 3 reading specialists at River Bluff. So that's where I was pulling my information from. Thank you.
I want to follow with both Frank and Donna. I think I agree with Frank when looking at the challenge that the schools may have because of different behaviors. I think we have to keep our psychologists in each school. I called different school districts. 2 of them are very similar to ours, DeForest, Monroe. And they all have, actually they didn't have 1 school psychologist in every building. And a few years ago, they started cutting and going back to 1.0 FTE. But then they also have more counselors, so which is probably what would make, I don't know, for Ron, the position of dean of the students, not as dean of the students, but helping with who is going to be first responder in the time of crisis. So they do have more counselors in each school. So I agree that we have to keep our psychologists, add another one for River Bluff, or add one for River Bluff, I mean, but maybe looking at seeing, either waiting, as Donna said, to see how is it gonna be going during this year and see if we really need it for next year, or adding any teacher assistant, or how you call it, EAs, to help with that problem that they are facing right now. But then also, I'm going back to the reading specialist. I think, I don't know, is that reading specialist for each grade, Trish? For each level? Or can you explain that again?
So if we eliminate the position, we would go down to 2 reading specialists and a reading teacher for next year. So there currently are 3, but we would be going down to 2 reading specialists and a reading teacher. And recognizing that is in addition to staff in the building who also teach a section of reading. So we have the opportunity next year through the model that we're pursuing to have a reading specialist, to have Sarah Miller be the reading specialist in charge of support and structure for the program grades 6-8. So we're really excited to be pursuing that push-in model with Sarah Miller. And I think to the question that Donna brought forward, one of the things that we're excited about within that model is the co-teaching that could be done over multiple years, so that we recognize we want to make sure that we're growing all students in their literacy, and we really believe that that will be an important part in narrowing our achievement gap.
Because I'm a little worried, I wanted to know exactly or a little bit about the transition from elementary to middle school, especially for those having especially in reading, in a reading situation.
Yeah.
Kids with dyslexia or something like that, they're going to 6th grade. So I want to make sure that they are receiving the service that they need.
Absolutely, absolutely. You know, recognizing the push-in model that we're using this year, we've seen substantial increases in all grades, across all reading standards. So we are really pretty confident that that position, given the fact that it's been doing pull out, which we are finding is not effective at all, that we believe we, through that co-teaching model and as Laura shared, designing to the edges, is really pushing our literacy scores forward.
Thank you.
Yep.
I sympathize with the interest in retaining school psychologists in all of our buildings. So I'd like to first state that. But we have revision 5 that we're discussing right now, discussing improving. And to me, the staffing recommendations that were presented by our administrative team is an acknowledgement of the last couple of years of increasing behavior challenges in each of the elementary schools that we've consistently been approached by the community, by our constituents, and then also by our administrative team. We've acknowledged increasing behavior issues, or increasing load of behavior issues that we currently at all of the elementary schools seem understaffed to attend to. And it's, as Frank mentioned, and as our administrative team mentioned last week, or 2 weeks ago, it's pulling principals away from their responsibilities. It's pulling our school psychologists away from their specialties, and it affects our educators' abilities to manage their classrooms and manage a bunch of kids that they're specialized to be teaching. So the original recommendation seems to be an acknowledgement and an attempt to address these staffing shortages. And so if we do end up passing some sort of revision or one of these proposals this evening that does not in any way directly acknowledge these staffing support requests by our administrative team, I believe that we owe it to them to somehow communicate that we have heard their requests and want to take them serious in trying to address the increased behavioral issue loads that we've seen for the last couple of years, because without any active staffing changes, I don't see how any of those issues will change, and we have been reminded of these issues for a couple of years now. So I don't know what kind of an acknowledgement we could give our administrative team, but we do have a meeting in 2 weeks. If they could somehow, if we approve a plan that does not include any of these Dean of Students positions or any sort of position that tries to staff up to fight the problems that we're seeing, or that we've been told exist, or the shortages that we've been told exist, maybe in 2 weeks they could come back with an additional recommendation that we could consider. But I think we should go out of our way to acknowledge the problem that they've expressed exists in our elementary schools, because the revision that we're currently discussing right now does not at all acknowledge the major problems that they have expressed they need help with.
And John, I appreciate those sentiments, and I appreciate Frank's sentiments, and I understand the board, and Tim stated from the constituency standpoint of keeping the Sykes, and that's a judgment call, and that's something the board and administration wrestled with greatly. But I would be remiss if I didn't say something about my belief for a need of the Dean of Students. I worry about the capacity of my administrative team. I worry about, especially at the elementary level, where they are dealing with an increase in mental health, even with full-time psych, even with a full-time counselor. They are dealing with a change in our students' needs, while along with trying to move the building forward, trying to move our academic achievement data forward. And you've heard from community members about concern and discipline. You've heard from staff about concern about supporting them, and the training and the support that they need. And right now I worry that my elementary principals do not have the time or capacity to work one-on-one with the staff members and give them the support they need in the classroom and help the teachers in meeting the needs of this diverse group population, because they are called in the front line of an emergency, in the front line of a crisis. And so I believe, whether it's tonight or whether, as John suggests, we bring it up at a different meeting, I believe that our elementary principals need, in order to move the buildings forward, and our staff needs to be able to free up some time for our elementary principals to actually work right in the classroom with the teachers, side by side, in helping them better meet the needs of all of our students, and better hone their educational and tools and instructional. We need to let our elementary principals be instructional leaders. That is what they need to do to move our buildings forward.
Joe?
So I, like Frank and John, I'm struggling with second guessing the administration, and Tim specifically. I don't think you would have asked for these positions if you didn't think that we needed them. But I also am in the camp of thinking that we need to maintain the school psychologists, and ideally for me, I think add one at the middle school, which brings us to revision number 3, and I don't know if we need more time or if there's already been a motion, I understand, but this is a big deal, and maybe we need to actually take a look at that and talk about, are we comfortable going $120,000 over budget to have the things that much of the board and many of the constituents think that we need to have, and the people that Tim thinks that we need to add. And I just want to reiterate, I don't think he would have asked for them if he didn't think they were going to be darn helpful. So that's, I guess, where I'm at.
Steve?
So I will also agree to all the discussion points that have been brought up around the possibility of revision 3. Well, what I would throw out there is if it does come down to a matter of costs, how we could currently look at some of our contract, I'll call them contract employees, or people who have worked for the district who are now on contract, providing some type of consulting service, and cut those services, because I'm not really entirely sure. Not entirely sure. I'll give an example of Cheryl Price as I don't know if she's a mentor or whatever she's doing for the district, but I know she works in the 4K program, but I don't know what else she does. So are there those type of people that are providing a service today? So it would be give and take. We're cutting some outside consulting services for the sake of adding the staff that the administration is recommending. So that alternative, that revision 3.
Yeah, I'll let Tim address that, please.
Those are all possibilities to look at. We did have conversations on different consultants, and I don't feel comfortable talking about the merits of a particular person, right?
Yeah, that's fine.
At this
I
point.
just do that.
And I'd be happy to have that conversation. But that is a possibility. That is a possibility of revision 3 would put us $120,000 over what we have currently budgeted. Not to say that if the board directs us to redo budgets and refigure out how to find the $120,000, not to say that we might not be able to sharpen our pencil. I'm sure we could and figure it out. Or we could go over. Those are all different options, but we could have conversations, as Steve is saying, about consultants. We have multiple consultants, but each consultant adds something of value, and it's weighs the pros and cons of, if we don't use this consultant, what do we, what else do we do, or how do we internally use those same services? That's not to say that we can't have those conversations. That's not to say that that isn't a conversation worth having.
Allison, and then you.
And again, in moving approval of this revision, I don't want to discount the idea that there's probably a decent amount of benefit to having deans of students. It's difficult to get past the idea when we're listening to a number of presentations that we had tonight indicating mental health needs in so many different aspects of our society, but of course in the schools. Not having a psychologist at every school seems maybe not the best way to have that staff be able to help our kids, and it just doesn't make a lot of sense to me. Having deans of students, I can see the benefit of doing that, but I do wonder about how that would work if that is the first responder. If the dean of student is also responsible for meting out discipline, I don't know how effective that is going to be for a kid that's in a crisis the next week, to know that that same person that's responding to them is the one that got them in trouble the week before. I am wondering if there are other ways we can study how this position would work. And so, like Donna, it's not that I don't think there's some benefit to this position. I just am not sure, one, how we're going to afford it. at 120,000 over budget. That would be great, but I just don't know that we have the money, and maybe we could find it. But that is something that I think we could study more, and so take a little bit more time to look at what else we could do to improve that situation, to be able to support our administration.
I'll let everyone else who still wants to say something do so, but I wanted to weigh in at this point. I think it is critical that we listen to the experts and the people who are actually working in the buildings as to what they feel their needs are. It greatly concerns me to hear that it's not uncommon for an elementary school principal to spend 2-3 hours of a day dealing with one particular kid's problems, when that principal has so many other things that he or she is responsible for. Excuse me. They've got budgets to deal with. We have a lot of people who are new to the profession of education in our schools now. Pardon me, if memory serves, almost half of our teachers have less than 5 years experience. One of the principal's chief jobs is to mentor these new teachers. And if we instead have our principals having to spend so much of their time dealing with kids in crisis, there's nobody else in that building that can do what the principal is supposed to do. There just isn't. So what I hear them saying is, we need somebody to take some of this burden off of us and off of our school psychs so that we can do the thing that you hired us for and that you're paying us for. And that's why I'm against Revision 5, because all it does is authorize the hiring of a school psychologist for River Bluff. Doesn't do anything else that our building principals have said they need. We have 2 assistant principals at the high school. We have an assistant principal at the middle school. We have nobody comparable to that at the 3 elementaries. And so that burden falls on the principal. The idea behind this is to have something sort of analogous, at least, to an assistant principal at our 3 elementaries. And I think we've been given some really good reasons for why something like that should be done. I guess if we're going to pilot an idea, my preference would be hire the 3 school psychs, or excuse me, hire the 3 deans of students, leave the school psych position off and see how things go this year. And then we can see if we really do need to hire another school psych. That would be my preference. So anyway, we're still discussing revision number 5. And if we're going to take up anything else, then we have to call the question on 5. Yolan.
Well, I'm having a really, really hard time understanding why do we need specifically a dean of students, because we are talking about the rising on mental health. And dean of students are not trained to deal with mental health, even if they're going to be a first responder. I heard before last meeting that people can be trained, teachers can be trained to respond. So I see, for example, the salary of a dean of students is basically the salary of an administration person in comparison to a school psychologist. And I'm having a hard time to understand specifically that. I just don't understand that. Also, and I do respect all of you, the administration team, and understand where you're coming from. I would like to know, when we're talking about listening to the experts, did you guys also talk to the psychologists and see, school psychologists and see what are they thinking about it, or how can they include something, some ideas. I don't know if that happens during the meeting. But what I'm saying is, I'm listening also to the experts. I'm listening to people that work specifically in mental health, that works in the school, families that also have been benefited by having a school psychologist. I talked to different schools. 3 of the schools went from less school psychologists to increase school psychologists because of the same reason, having a lot of problems with mental health and behavior. So to me, really, we can hire some other people that not necessarily are going to cost. You can call it dean of students if you want, but they're not going to cost $83,000. And they can be the person that is going to be in the school, being the first responders. And we don't have to come out with that amount of money. That's what I think.
Tim, do you want to address that?
Yeah, so first of all, the $83,000 is salary and benefits. $83,000, why it's higher than 75, which is what we use for a beginning staff or somebody right out of college, et cetera, is because chances are these deans of students might be staff that we already have. There's some extra days built into their contract, some extended days, so that they are working with the administration before school starts, before everybody else comes, and after, just to kind of work and shoring that up. It's called a dean of students because that gives us the flexibility to hire. We're not bound by a certain certification. We're not bound by a certain license, like a chemistry teacher or a math teacher, etc. It can be any license. And you look at current staff, potentially, that we have that have some additional training. We've sent people to trauma-informed care. We've done some training with our staff that go above and beyond what normal training is. And so it could be some of those people. It could be some people that, though, who may not have that training yet, but we could give them a training. So it's called a dean of students because it's the flexibility of, we've not narrowed it down to any one licensure. It could be any licensure. We did not call it an administrative because if you look at salary and benefits of an administrator, that's more than the $83,000 for an assistant principal. An assistant principal also has the duties and can do evaluations. That's why an assistant principal, is more costly sometimes than that. These dean of students would not be doing evaluations. They would not be doing evaluations of staff. They would be working with students. They would be establishing the relationship with students. Sometimes students come down that are having a rough day. It's not a matter of disciplining them. It's a matter of helping them calm down. It's helping them get into a place where they can go back to the classroom. It's establishing that rapport with that student so they feel comfortable. I'm having a bad day and I just need somebody to talk to help calm down. It's another relationship type of building. That's what our building principals are doing sometimes when they spend 2 hours with one individual student. They're helping that student get to a point where they're calmed down, where they can help work with them and get them back into an educational setting where they can learn. So Dean of Students gives us the flexibility to hire people of different licensures.
Donna?
So would any of the current school psychs be able to apply for that position?
Yes.
And somehow we got off the track. I don't think any of us here feel like we think the Dean of Students is a bad idea. I certainly don't.
Right, exactly.
I'm trying to just do the best with our budget, but that also I feel like meets the needs of the larger amount of students. I'm going to go back to data. We don't know how many referrals does every school have. We haven't seen that. We haven't seen how many it's a gut feel. I think I can spend on my worst day 4 hours on a certain student, but do we have data that actually tracks that? So we could look at it. And that's all I'm saying is that I'm asking for a little bit more time to just look at the different sites and see, what is it that we're actually looking at, and maybe we'd see that the Dean of Students isn't something that is, maybe there's something else that we could be doing. Are we consistently applying our PBIS, which I just read an article in the paper about, are we consistently applying that across every site? I'm wondering if we are or aren't. What are our referrals across each site? I don't know that. And are we consistently, as a team, do we get together district-wide, with all of the individuals that are responsible for PBIS? It sounds like they do it differently at every school. That's just my gut feel. I can't, because just from what I've heard. So I'd be interested in that information, but I'd also be interested in knowing what the school psychs how they could help with this situation. If they're the ones that have been working with kids and maybe do some initial screening of kids and know which ones are gonna maybe have some problems, then we can be more proactive than to be reactive. And Allison made a good point. How can a dean of student who's doling out discipline one day be the person that's going to be helpful the next day to a kindergartner? I think they're not going to understand that. So I don't want to say that we are not, that we don't respect anyone here and I applauded everybody for thinking out of the box. I just think we need a little more time to come up with a solution. If after a year it seems like that's what we need to do, then we figure out and we find the money. But I'm worried. I'm especially worried at the high school about not having a school psych. They're full-time on-site. So that's my
Kelly,
2
did you
cents.
have some response to any of that?
The data
Come on up.
There was data on initial referrals or initial evaluations and reevaluations in your packet. So I gave those numbers per each building written out, and they were initial evaluations and reevaluations. So that's your list of referrals. Not behavioral referrals, but evaluations and reevaluations of our psychologists. That was based on, I did it a year-round data, so from January 1st, 2017 till January 1st, 2018, because that's the firm full-year data I had available to me in IC. So.
But what is the difference between an evaluation and reevaluation and a referral?
An evaluation takes place when the referral is made.
Okay.
So all the initial evaluations and reevaluations are just required every 3 years, and initial evaluations initiate upon referral.
And what about number of discipline? I mean, do you have discipline referrals? Do we track that?
Yes, in Infinite Campus.
And so did we get that data too?
No, I don't think we put that data in there. That wasn't one of the questions you had asked, so we did not put that in there.
Well, the first time this was brought for us, it was it was said because they were dealing so much with behaviors and discipline. Then the next time it was instructional leadership. So to me, the first time would have been a good time to know the number of discipline, how it is in each school, because I don't have a good feel for what's happening at each individual school. What is it that's taking away principals' time from doing what they're supposed to be doing and dealing solely with children?
Because the principals gave that time length average in a day in which they were spending on behavior. I don't know if the principal has any more information on that.
Okay.
But I could get numbers of referrals, but we keep track of all the minor and the major referrals. So that could mean a wide range of how much time each of those take.
Other questions? Allison?
I guess one of the things I'm kind of struggling with on the numbers is I know when we've, last month we did a tour at Sandhill, and in the past when we've gone to Kegonsa in particular, popping up in my head, I have more than one apparently, up in my head, is that a lot of the negative behaviors that we were seeing that resulted in referrals had gone down because of a lot of the things that we had put in place. With play-based, kindergarten play-based learning, that the numbers we got in the packets were saying that actually things were improving. So I guess I'm not, are those different? Is that somehow
I'm not sure what you're referring to. As the information you got on the referrals, on the behavioral referrals.
I can. So, I don't know if I'll be coherent. Yes, so I think in large part, like our referral data is really showing great improvement. But we still have significant behaviors that, and we keep talking about psych, that we're also pulling from counselors all day. We're pulling from learning strategists, special educators all day, and doing behavior response. So this is not just about the principal or the school psychologist. It's about, like, all of us are doing behavior all day, so it's multiple people. Have behavior referrals gone down? Yeah, but we still have a sizable need, and we have kids that are with increasing difficulty that are in our schools. And so it's a yes and. That proactive piece is critical. We agree. But part of it is we're spending all of our time doing reactive and piecemealing. So if any of you work during the day, so you start something and you're in it, and then 5 minutes later, you have an earpiece go off that you have to respond to behavior. And then you get back, right? It's welcome to the job, but yeah, right? But then you get back and you're like, wait, what was I doing again? So that's like all day, but it's multiple people. It's the school counselor, or it's the learning strats who should be working, like they're pulling out to support to the extent that they're able. But I mean, it's a team approach. And I also, one thing I really want to say, and I'm super passionate about this, is the reality is we can't assume one role is going to solve our mental health crisis. We all know this. We know this. The school psychologists, amazing humans, are not going to solve the mental health crisis. And we are moving beyond a belief that one person that goes to the office and they get fixed. Like, the fix is all of us working cohesively together. The fix is us collaborating. The fix is all of us being deeply trained in mental health service. So the Dean of Students is really just another person to be able to support that continuous and coherent behavior response, but also build those relationships, but also training. So whatever the decision is, like, it's also important that, like, we're moving away from that model where one person, like, fixes it, because it's not something that one person can fix. It is a school issue, is a community issue, and is a national issue. And so that, I think, is really important to put on the table as you discuss. And again, the whole purpose of this was to be able, for people to be able to do their jobs, and to do it well, to be able to do that deep, proactive work, of that individual counseling, of that group counseling, of the lunch bunches. I mean, we detailed our lunch bunches today. Like, we have all these lunch bunches, but at any point, people can be called to do behavior support. So it's being able to free up everybody, and it's not just us administrators, it's about our whole student services staff and learning strategist staff.
We talked last week about, or a couple weeks ago, about ACEs. So you're looking at almost 70% of the kids in our classrooms, we can assume, are coming home with at least one adverse childhood experience. And chances are they've had more than one. They've had one, they probably had two or three. So if you look at, we have to build a teacher's capacity in order to respond. It isn't just always just called mental health. It's also social, emotional skills of our kids that have had trauma, and we need to respond differently. And we have to build the capacity of these great educators in our classrooms.
Who are with the kids
They're
most
all
of the time. Like at the end of the day, school psychologists being able to go in and co-teach and work with classroom teachers who are with our kids 7 hours a day is super impactful. All this proposal was an idea on the table to figure out like how can we get this done in a way that meets the needs of kids. Kids are at the center of this decision. This isn't about anything else except what can we do what's best for kids. So I hope that spirit is.
So would it be fair, I won't put you on the spot, so it'd be fair to say that you'd like both? You could have full-time school psych and full-time?
Yeah, and that it would rain money.
Well, I'm just, no.
Yeah, of course.
I understand that, well, I know, because can you respect the fact that I'm having a hard time understanding how reducing from one area into another is going to solve the problem? That's where I'm struggling. I understand the dynamics of the dean of students and the different things they can do. I'm also struggling understanding how you're going to free up time with a school psychologist to do their work by reducing them. It's counterintuitive to me. And you can go into a school year with the best laid plans that are going to say this is what this person's going to do, but I know for a fact that never works. I'm struggling. It's counterintuitive to me. I've never seen it work where you have somebody in the role of school psychologist traveling from school to school. I've never seen it work ever. And so I want to make it clear. I want to piggyback something Donna said. I respect the proposal. I respect the fact that you need a dean of students. I want to try to give you that. I want to just make sure that we do it without taking from somewhere else that I think is as crucial as being part of your team to meet those mental health needs, but also to be in a reactive mode.
I think the most important thing we were trying to come with is a fiscally responsible plan.
Yeah.
Something
Yeah.
that was fiscally responsible and we're charged with that as well. Manage the budget and fixing the problem. So this was given a lot of thought.
Yeah.
And, a lot of discussion. Fiscally responsible was the reason why the recommendation came the way it did.
Frank?
What do we do for psychology services at River Bluff now?
I was waiting for somebody. We hire a consultant that comes in and just does testing for us right now.
Do we know how much that person costs?
Yes.
How much does that person cost?
Oh, gosh, I don't have all the invoices in front of me, but I think ultimately because we just pay her to come in and do the observations, to collaborate with staff, and to do the testing. I think so far, halfway in the year, Erica, I think you might even have some better ideas. I think it's around $7,000 so far. $7,000 or $8,000 we've paid her for a per diem. Come in and assess and work with that decision.
Is it fair to say that if we hired a full-time consultant at River Bluff, we would no longer need those services?
Psychologist.
Psychologist. I'm sorry.
Right, so it really is, I think the question is about the services and how the services are provided. Because certainly there is a part of the school psychologist role that is really narrowly defined in terms of what is required through special education, and with the loss of Jody Peter-Schmidt to a different district and being, again, unable to find a person. So I think that would be one thing I would want the board to really think about as well, is how many of these people are we going to find? We contracted out for just those specialized services. So in order to do some of the out-of-the-box thinking at the beginning of the year, took a look at, well, what are those services that school psychologists do? And River Bluff hired a full-time social worker to pick up some of the load of supporting students, but we also shifted some of what our school psychologists historically had done to other areas like counseling. So I think what's really important here is recognizing that, really, I think for all of us, K-8, the issue is we have some students with significant mental health that we really need to be helpful and supportive of, and I can really recognize the challenges that we have as school principals when you can't get to all of those other parts of your job. Part of the work that I've really seen a change in my time with the Stoughton Area School District has been having to mentor new teachers. As people have retired or moved on, there's a lot of work that needs to be done to support teachers new to the profession or new to the Stoughton Area School District with our inclusionary practices. So the short answer is, do I believe that River Bluff necessarily needs a full-time school psychologist? No, but I do need a certain amount of psychology services.
Okay, and that was not the question I had asked, but
You've got more.
cool. So I want to make a couple points here, just see if I can sum up where I am. Thank you all very much. Walk faster. So I've been going back and forth on this since before our last meeting. And with respect to my colleagues who nominated and seconded the proposal, I can't support proposal number 5. And this is why. Proposal number 5 doesn't do anything to fix what we're hearing about the elementary schools. We're trying to balance 3 things. We're trying to balance the needs that we have at River Bluff. We're trying to balance the needs that we have at the elementary schools. And we're trying to balance the fact that we are a declining enrollment district with a declining budget. And that every year there's going to be a little less money. I don't know what the right answer is. But when I hear the staff at the elementary schools and the administration saying that we need additional support at the elementary schools, I believe them. And I will support a proposal that provides some way to deal with what we've heard described at the elementary schools. I am concerned that in our discussions that we are conflating crises or general student issues with mental health issues. Not all student issues are mental health issues. Some are, some aren't. And I am not convinced that a psychologist is needed to deal with every student crisis, or even most student crises. Having heard the comments from the community, the comments from the psychologists, having read a fair amount of the voluminous materials that I've been sent and asked people to send me, I agree that having competent student psychologists who are able to provide the services that school psychologists provide is extremely important. I also think that it is extremely important that we find a way to address the difficulties that our elementary school principals continue to tell us that they face, that we find a way to put our principals in the position to succeed doing the things that we have hired them to do, which is to run their buildings, mentor teachers, and do all that other stuff. And I don't think Proposal 5 is the answer to any of that.
So Frank, would you like to call a question on proposal number 5?
I will call the question on proposal number 5.
Is there a second to that motion? It's a motion to vote on the motion and close debate.
And the reason I'm struggling with seconding it is because I'm not clear where we go after that vote.
Well, let's see how the votes stack up.
What do you mean with?
Okay,
If the vote were to fail,
well,
where would we go?
okay. Calling the question is a motion to close debate on the motion to approve number 5. If there is a majority vote to vote on the question, then we will vote on the question. So this is just a motion to close debate. Is anybody going to second that?
A second.
John? All right, all in favor of calling the question? We'd probably better raise hands because I don't think we're going to be unanimous. All in favor of voting on the proposal number 5? Please raise your
Say
hands.
again, I'm
Do
sorry.
you want to vote on proposal number 5? If so, raise your hand. Okay. Now, all in favor of approving revision number 5, please raise your hands. So we've got 1, 2, 3, 4. That does not carry. Excuse me. I will make it through this meeting, I promise.
You think the meeting's going to end, Scott?
Would you entertain another motion then, Scott?
Yes, thank you.
I would move that we vote on revision number 2.
Okay. Is there a second to that?
Second.
That's from John, okay?
Revision number 2, did you say?
Yes.
Which basically keeps the school psychologists that we have, if I'm understanding it correctly, and adds the deans of students. And results in $45,000 budget, which I think is manageable since we thought we could sharpen our pencil to the tune of $120,000.
Tim, do you want to address the money aspect of that, please?
Well,
and whether or not we're characterizing it correctly, too, I'm sorry.
You are characterizing it correctly. Revision number 2, which is the motion, would add the 3 dean of students, would keep the school psychs. Basically, it would keep what we currently have with school psychs, which means 4 school psychs for the district. And then we'd probably be contracting services to help with the testing, et cetera, like we did this current school year. It would put us over budget by $45,000. There's a little bit of you're weighing it, $45,000 in a $40 million budget. When I say we can sharpen our pencils, I think we can come up with $45,000. But it does technically put us over budget by $45,000. We need to reallocate some money or redo our budgets to make sure that it balances, but we would be, actually our net increase of staffing would be an increase of $45,000.
And this, again, is on the coming school year.
Correct.
So we don't have a budget passed for that yet anyway. Steve?
Well, so that I understand it correctly, this is 120 based on, or I mean $45,000 based on our current budget, which we have.
Our current staffing, our current, how much we're
budget
paying.
set. But we had a situation this year where we had money, from the governor's budget that came in.
But that is,
So-
this is recurring money, so it would be $45,000 recurring expense. And so what you look at with declining enrollment in decreasing students, a lot of times you look at reducing your recurring costs because you're not getting that money on an ongoing basis. And the surplus we have is one time
Yeah,
this year.
I did just want to clarify, not to contradict, but just to clarify that for next year, an additional $45,000 or additional $100,000 is not the problem. It's when we look at those future projections, by adding to staffing levels, that, can exacerbate the future deficits that we're looking at. And again, I always put the asterisk on there. That's, based on a lot of assumptions, multiple state budgets down the road. But again, with the original recommendation, the approach we took was to look at, given what those future projections look like, given what our enrollment projections continue to look like, which is a decline, how do we maintain a staffing level that was status quo? So again, I don't want to create a perception that by making these decisions, we're going to put ourselves in a position next year to be over budget as a whole. But again, it's what Tim was saying, that when you look at those long-term fiscal projections, there is an impact. So I just wanted to clarify that.
Thank you. John?
To me, this revision addresses the completely valid concerns of so many community members that have expressed interest in retaining the school psychologists that we already have and that I align with myself as well. But we've talked a couple times or mentioned a couple times coming up with some sort of a pilot program. This looks like a pilot program to me. We have our administrative team has communicated for a while that we have, that there is a burden on them that they cannot address and that they probably need additional staffing to address. We can afford to see if they've given us their best estimate of how we could immediately address these concerns. We can afford to address these concerns or test addressing these concerns in what is a fiscally conservative budget deficit from what we had projected to. I shouldn't say it that way, but it seems like it seems like if we were going to figure out some sort of a pilot program, I don't know how we figure out a pilot program without spending some sort of money on it. This seems like a staffing problem. It's been communicated to us as a staffing shortage. So at some point, we will likely have to hire some sort of staff to help address this problem. So I guess I'll just leave that.
Yoli?
Well, if we're gonna have a pilot program, why do we need to use all the schools for that, all the 3 schools for that? How about looking at the school that has the most behavior problems? And then having the dean of students in that school and see how it goes for this year, and then continue seeing it for the rest of the schools. If that is gonna be a pilot project, as you said.
Yeah, come on up.
I just had a thought as I was sitting there. I'm going to go back to what Tim said. Because these are going to be staff members that are going to be in an elementary school, they don't have to have a specific license other than they have to be qualified to work with that age group, and they would have an elementary license. So if this was something that you decided a year from now is not working, more than likely we could absorb those roles into buildings because we have elementary turnover all the time. So it might be one way of looking at that. Because, I mean, that's the other thing, is one of the reasons we even looked at this option is we always looked at retirements, resignations. We could have a less impact on our staff. So this would be, so that's really how this, one of the reasons that this started, but it might be another way of looking at adding him.
With Becky's point, if that is something that you would be considering, I would recommend and suggest you don't do it just after a year. Give it 2 years, maybe 3 to collect the data. Maybe we monitor it every year, but give it a couple years to see if it, and maybe you amend the motion that says, we are going to pilot this for 2 years or 3 years, and after that time, we will reassess whether we are keeping these positions on an ongoing basis. And that way you are assessing it, you are looking at, is it meeting the needs, is it having a positive effect? You are piloting it with all the schools, but you are saying it's not going on in perpetuity. We are going to have somewhere in the future, we will make an assessment whether we are continuing this or not.
Well, these all involve annual contracts anyway, so
Right.
I don't think that we actually have to decide tonight what kind of time limit we may or may not want to put on this if we were to pass it. The board can evaluate it 8-10 months from now and decide whether this is something we want to continue doing. Joe?
Well, it's come up a couple of times, this idea of piloting it at maybe one of the schools. I think that that's not doable or a good idea. I mean, I think, say it works swimmingly and everybody next year wants to send their children to that particular school, or, I think if we're gonna do this, we roll it out, we gotta do it at all 3 schools. That's my 2 cents, but I don't see it working as, let's try it at one.
So there is a motion on the table to approve number 2, which would retain the number of school. Did you have something else?
I'm sorry, I do have one more question. And Becky, I just want to make sure I understood. You said that you were saying they wouldn't hold a license, but according to the qualifications.
No, they have to hold a license, but because they're going to be working in an elementary school, they don't have to have a specific license. Like, they're not administrative, they don't have to hold a counseling license, a reading license.
Okay.
But they have to have an elementary license for the grade level of the building.
Thank you, that makes sense.
Steve's got it.
Oh, Steve, thank
So
you.
just to be clear, number 2 says River Bluff status quo is okay. And I don't think that's right. I think we should have a school psychologist in every school. And we're saying, on one hand, we're saying mental health issues and social emotional issues are important. But on the other hand, we're saying not quite so much at River Bluff. We can contract that service and we'll be okay. So I just need to say that.
Well, I don't
But there
think
is a
that's quite
social worker.
accurate. Yeah.
Right.
they have
Not
a
social, I'm not
worker.
saying okay, so.
Well, what I
Yes,
was
there's a
also
social
going to
worker,
say
but-
is, we would still have 4 FTEs. They can be allocated among the 5 buildings as needed. It's not,
But I thought we were saying our preference would be to have school psychologists at each school. But
well, that's what some people have said, yes.
Well, I didn't think they were gonna be roving around. I thought that by choosing this option, at least the elementary school sites would stay put,
Well,
but I don't.
This is just staffing, this isn't assignments, yeah.
And, true, so, sorry, then, to that point, then there could be some roving, and then that would take away potentially what we were, one of our objectives appeared to be, and maybe I'm speaking too broadly for everybody.
But I think the idea is that by having deans of students, you free up some of the time that school psychs are spending on crisis management. Is that correct?
Right, but there's always a potential for any staff member to be assigned multiple buildings. So there's always a potential, we have teachers that teach in multiple buildings based on assignment, and I think of our ag teacher at the high school. Also teaches a section of ag at the middle school. So there is the potential always for staff to rove. Remember, at the middle school, though, as Trish said, we had a retirement of the school psych. We couldn't find a school psych last year. So she hired a social worker to meet some of those needs that the school psych was covering, and then reassigned some of the tasks to the counselors, and we contracted that specific service that the other staff couldn't do. So if we add a school psych at River Bluff, then you have a school psych and you have a social worker at River Bluff. Not to say that, that's not a bad thing, but there are, the services that the school psych at River Bluff were performing were kind of divvied up between a social worker, counseling department picked up some, and then contracting the actual testing and referral status at River Bluff. And we have shared, we have shared social workers for the elementaries, right? Is that correct? Mm-hmm. And high school. And high school. So we could share that social worker for River Bluff? I mean, if school psychologist is that important, we're saying it's not really that important for River Bluff.
No.
That's what number 2 says.
Well, we just
No,
heard
it's
from Trish,
not.
she was comfortable.
But it
Okay.
could
That's
be
why
what
I'm-
certain people. It's in the eyes of the beholder.
Okay.
Yeah,
I don't
have
support
to-
number 2, so.
I have to say that, to me, it's very important that you have, Trish, you have a full-time psychologist there, because I still think about the transition, the elementary school kids to your building. But you're saying that it has been working well. Is that right? The transition from 5th grade to...
I think that the challenge that you have before you is a large one, and partly, I think it's going to be really important to think also about budget and long-term success. So it has worked well to have contracted services and to have the school social worker at River Bluff. And we paid this past transition from 5 to 6. We spent a lot of time working with special education, administration, social workers, counselors, to make sure that things went really, really well.
However, I have heard many times about, actually I have heard of more of behavior problems in middle school than in the elementary school. And so that's why I'm kind of like, well, how are you managing, you know, that we are hiring the DSOM students for elementary and no hired any school psychologist for River Bluff. But I keep hearing more of a behavior problem in middle school, so I'm kind of confused.
I guess what it comes down to for me is that the people that are running those buildings are telling us what they need. And I think we have to give a lot of deference to that.
And
rather than second guessing it, which is kind of what I'm starting to hear. Trish says, I don't need to have a full-time psych at River Bluff given the other resources I have.
And I would just answer that by saying the behavior situations that you may have at an elementary are not what you have at middle school. And so there, I think you heard that we have a lot of students that work through our counseling department. So honestly, I think it's worked well. I have not received any parent complaints or concerns related to the school psychologist, and we, you know, are moving forward effectively. So,
okay.
Thank you.
Thank you.
Tim?
I can support number 2 with reservations. I hear what Steve is saying. I also hear what John said in regards to it is giving the principals what they requested. I think it's also addressing the need that we've also heard. I do have to say this, though. Through this process, I have some concerns about where this district's at in regards to its implementation of multi-tiered systems of support and implementing PBIS across the sites with fidelity. And that, I think, to assume a school psychologist or a dean of students can do some of the things a school psychologist, I quite frankly think is irresponsible. I think that, so I'm looking forward to a larger discussion and hearing more about where we're at with that implementation, because multi-tiered systems of support, for those of you that don't know, that is how it all fits together. That's how it all works, and that's how we're providing our students with mental health needs. And one of the key players in that is a school psychologist. And certainly there's some things perhaps the dean of students can pick up to address that. But we heard a presentation tonight about some of the issues and things that we're seeing in regards to mental health, and so I can support number 2. I think it's okay. I do think it's great that we're getting the principals what they need so they can do their jobs. But I would like to have a larger discussion about it through this process, quite frankly, because we've been close to cutting a key player in ensuring those multi-tiered system supports are working and they're in place. And
Don?
I think number 2 is a good compromise for what most of us are saying, and therefore I call the question.
Okay, is there a second? Frank?
Second.
Okay, all in favor of closing debate and moving on the motion, the original motion?
Aye.
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 Any opposed? Okay, all in favor of approving revision number 2 as presented tonight, please signify by saying aye.
Aye.
Any opposed?
Nay.
Okay, and for the record, the chair votes yes. All right, thank you. That is it for discussion action items. Excuse me, board members, we do have reason to move into closed session pursuant to section 19.85 sub 1 sub C for review of employment contract with the superintendent of schools, including consideration of any modifications thereto. I would entertain such a motion to move into closed session.
I so move.
Second was Frank, second by Steve, and then we need a roll call vote for that.
Ms. Fitzgibbon?
Here. I mean, yes.
Mr. Bouban?
Yes.
Ms. Tarpinian?
Yes.
Mr. Fry?
Yes. Been a long night.
Ms. Sword?
Yes.
Mr. Coughlin?
Yes?
Mr. Sullivan?
Both here and yes.
Mr. Jackson?
Yes.
President Dirks?
Yes. All right, let's meet upstairs at 10. Gives everybody a chance for a bio break.